Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. It is that time, that place where I answer your orthopedic injury questions, your regenerative medicine questions. So I am very, very excited you are here. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. All right, a lot to get to. We don't have tons of time, but I will stay until all the questions are answered. A few things right up front. As I always say, this is not meant for specific medical advice. I'm not giving you medical advice. I'm giving you information and education on the topics that you ask about. I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, any of that. It is illegal in the United States to give medical advice to someone who is somewhere that I don't have a medical license, which is 48 of the 50 states. So this is for general information and educational purposes only. Also, if you want to ask a question, leave it in the chat, not in the comments. I cannot see the comments every time I say it, and every time after the show when I actually go into YouTube to look at it, I will see questions in the comments that I was not able to see. I can only see questions that come through eCam through the chat. So if you're seeing other people ask questions, look for theirs if you can't figure out where the chat is, but that is the only way I can do it. Finally, if you are a military veteran and want to ask a question about the disability claims process, that is not this show. That is a show that I will start at the bottom of the hour at 5:30 on my Veteran Nexus Letters channel, so go there. You're welcome to watch this, but I don't answer any of those disability claims questions on this show. All right, let's go ahead and get started. Catherine Goldman. I always love it when people use their real names, and I'd love to know where everyone is from. I'm always surprised how many people from all over the world, no matter what time I do this, if I do it at noon, if I do it at 5, anytime. When I used to do them at 7 p.m., there would be people from India and Australia and all over the world, so very, very cool. All right, Catherine asks, what would somebody do without surgery for a hip labral tear? Would BPC 157 be helpful? I like peptides. I think they can be very useful. Just in general, I don't know how much a peptide, and before I say that, I am not promoting peptides. I'm not telling anyone to use them. They're considered experimental. Most of them, including BPC, is considered experimental by the FDA. So I am not pushing them. I'm just giving information that may be helpful. So I do think peptides can be helpful for a variety of orthopedic injuries and pain. Based on studies and just a lot, I know, having done a peptide certification and everything else, they seem to work better for muscle injuries, tendon, ligament, things a little more superficial than deep in a joint, but it's certainly worth trying. I'd be skeptical in the case of the hip that it would actually help the labrum heal. It might help relieve pain, and in that sense that can be a good thing. Now, there are ways to inject inside a joint if you were going to go to all that trouble where basically a surgeon or a physician injects it into the ball and socket part of the hip. I would do something more likely to give significant relief than a peptide like BPC. That's where exosomes I think are particularly helpful, where PRP might be helpful, something like that. Maybe stem cells in the right hands, the right types of stem cells, things like that. I am not a big fan of cortisone personally, as I've talked about in probably every Ask Dr. Geier Live I've ever had, but that could be useful. As far as other things that might help, it really depends if that labral tear is the source of pain. I'm a big fan of physical therapy just in general to strengthen the muscles around a joint, to improve function, to take stress off that bone and cartilage of that joint. Doesn't necessarily help the labral tear heal, but there's a big role of that. As for anything else, it would really depend a lot on the specific circumstances of that patient. All right, Mercy Canoy. Hello, Doc. Ask about what I feel every day. I woke each day with my heart pounding, heard my heartbeat much more in my left ear. I will tell you, I am an orthopedic surgeon, so I am probably not terribly good with medical issues. If that is some sort of chest pain, cardiovascular thing, you're welcome to ask, but I don't know that I'll have a really straightforward, good answer for you. Omar, who has been on this show, I think, before, from Tajikistan, if I'm saying that right. I hope I am. Omar says, after meniscus and ACL surgery, after 1 year, if the meniscus becomes torn slightly so it needs surgery. So I'm not 100% sure I know what you're asking. It sounds like you had ACL and meniscus surgery, I don't know if that was a repair where the surgeon sewed the meniscus back together or trimmed part of it out. And it sounds like what I'm getting is there may be a new tear of that meniscus. Do you need surgery or not? It really depends if that tear is real. Again, if it's a repair and you repeat an MRI, sometimes the MRI shows what looks like a meniscus tear, but it's actually artifact from the healing tissue of the meniscal repair. If the first surgery was trimming that part of the meniscus out and it shows a new tear, that's more likely to be real, in which case you would potentially think about surgery. But also the other thing you want to think about is, are you having meniscus type symptoms? Very localized pain, maybe locking, maybe catching, something like that, and not just overall pain from recovering from that surgery. I would want to know for a fact that that actually is what's causing the symptoms before I'd talk about another surgery. All right, and Catherine is from Durango, Colorado. Very cool. Can't say I've been there, but I've been to multiple places in Colorado. Very, very, very beautiful state. Absolutely love it. All right, Sherman Barker. Talk a little bit about gout. Sherman is from Puerto Rico. So another one that is really outside the spectrum of orthopedics, but I'll talk a little bit about it because there is overlap with orthopedic surgery. This is really in, at least in the United States, more of something covered by rheumatologists, occasionally internal medicine, family medicine doctors, but typically rheumatology. This is a medical disease, an inflammatory process related to crystal buildup in the joint fluid of different joints. Big toe is one of the more common. Knee, sometimes you'll see in a lot of lower extremity joints. Occasionally it can happen in the upper extremity. I've seen it in the shoulder before. What happens typically, you get a very swollen joint, a very painful joint. A lot of times it'll be red and warm, so it a little bit looks like infection. And so there are lab tests that you can do for it. Sometimes you can actually stick a needle in a joint and draw out the fluid, send that fluid to the lab, and they look for crystals, and that can help you tell this is gout versus this is an infection. It matters because if it's gout, you're going to treat it with medication. If it's infection inside of a joint, like a bacteria, then you are going to talk about surgery where you go in and clean out the joint infection. So it's two very different things, and that's why it's important to know. Once, if it is gout, then not only is there medication to sort of get you over the acute flare-up, but then there are more chronic medications to take, hopefully to prevent the recurrences. All right, Cosmo, what do you think about having chronic heavyweight lifting injuries that came just from lifting heavy weights, nothing traumatic? So I'm not 100% sure. One, I'm a huge fan of weightlifting. I'd be a hypocrite if I said I wasn't, because I've done it 6, sometimes 7 days a week, and I've worked out and lifted weights since I was a senior in high school. So I've done it for a long time, and I generally think it's very safe. Now, if the question, again, I'm not exactly sure if it's lifting weights while being injured, if that's an issue. Typically, if that's the question, and I'm not 100% sure I understand, what you would say is, hey, maybe you can do exercises that really involve joints other than the area of injury, and even if it's the site of injury, maybe it's your shoulder and certain exercises hurt your shoulder, like military press. Maybe you find a way to do lateral raises or forward raises, things like that. But there's always ways to modify. If there's more to it than that I'm missing, please let me know, but those are sort of general thoughts. And I think this is, oh, here we go. Nothing traumatic, 17 years old, shoulder pain, back pain, neck pain. I mean, generally, I guess it depends on what the source of that pain is to tell you, should you work out, should you not? It really depends. Generally, I am of the mindset that exercise is generally good. Now, you want to avoid something that potentially makes a structural problem worse. So if that shoulder pain is due to a rotator cuff tear or labral tear, then potentially you would want to adjust your workout. Same with neck or back if it's related to a herniated disc or something like that. So it really depends on what the specific injury is. But again, generally, if it's not a significant injury, I'm generally okay with working out. A lot of times, though, you have to modify so that you don't exacerbate the pain, even if you aren't doing any more damage if that makes any sense. All right, those are all the questions I see right now. So if you have any questions, again, leave those in the chat. I'll stick around for another minute or so. But again, always like doing this. If you are interested in regenerative orthopedics and treatments other than surgery, other than cortisone shots, things like that, I wrote an ebook that you can get completely free. It's in the link in the description, or the link is in the description below this video. It's called The Arthritis Solution, although it pertains to pretty much anything in orthopedics, not just arthritis. And you can read about all different kinds of injuries. Plus, there's also a link in the description below where if you're interested in potentially seeing me as a patient to discuss options other than physical therapy, other than surgery, other than cortisone shots, you want to talk about more regenerative treatments, we certainly could do that as well. All right, Omar follows up. I don't have any locking in my knee. Also, my knee doesn't have any swelling. I think, again, it would be going back, and again, this is not medical advice because I can't see and examine you, but it's finding if there is a true meniscus tear, and that is an MRI, or a lot of times in the setting of somebody that's already had a surgery, what's called an MR arthrogram, where they inject dye into the knee and then do an MRI. So one, finding out if that meniscus tear is real, and then trying to figure out if that's the source of the problem, of the symptoms. Generally, I would think, be very little downside in trying to rehab through it and try other non-surgical treatments, see if it gets better. And if it does, great, you avoided a surgery. If it doesn't, that option always exists. I'm generally very conservative when it comes to surgery and try to make that sort of the last resort, and I don't think there'd be much of a downside in trying to avoid it. All right, Catherine, what would you suggest for arthritis in the hip? Yeah, there's not an easy answer to that. I try to help people. This is like a big focus of my medical practice, my orthopedic practice, to help people avoid joint replacements. That is sort of the end stage option, and the success rates from that can be good, but I think if you can avoid it, that's potentially a good thing, because there are a lot of activity limitations that come with having a hip replacement, and a lot of active people, like my patients, aren't super excited about those kind of restrictions. The traditional medicine world, or the traditional orthopedic surgery world that I was a part of for 16 years, there aren't that many options. There's physical therapy, there is occasionally cortisone shots, albeit that's not all that common, and that can actually speed up arthritis. I typically have my patients at least really try to avoid that. There's oral anti-inflammatory medications, there's topical, in theory, anti-inflammatories. I don't know how helpful that is for the hip, but those are two. And then activity modification, which again, a lot of people don't like to do. As you get into more of the regenerative options, that's where I tend to think, and I think those are very good, but again, I'm not promoting it. They're considered experimental. They're not paid for by insurance. But in that world, you're thinking about things like peptides, you're thinking about things like PRP or exosomes, a number of those types of things potentially can be helpful. In that Arthritis Solution ebook I mentioned earlier, if you want to grab a link to it, there's modalities that some people think are helpful: pulsed electromagnetic field therapy, vibration therapy, hyperbaric oxygen, all potentially could be, and there's some early studies that show they might be. I don't know that that's something I push real hard with my patients, but it is something to think about as well. And she goes on and says, I think the labral tear might be a cause of some of the arthritis, and that can happen. You get a degenerative labral tear and arthritis, and it gets to, a lot of times, the arthritis at that point becomes probably more likely the issue than the labral tear. That having been said that. But anyway, very good questions. That's all we've got, so I will stop there. I will be here August 4th for our next Ask Dr. Geier Live. I look forward to seeing you there. Keep watching my normal videos. Subscribe. Where are we? Subscribe to this channel, and you can click the bell and be notified anytime I release a new video and when I start these live shows. I really appreciate it. I hope you had a safe and happy 4th of July, and I will see you all very soon. Take care.